A lot of kids have bedwetting, and yet they don't talk about it. And I'm surprised at the number of parents who don't bring it up when they bring their child in for a checkup. It's one of the things I routinely ask about because it actually is a lot more common than people think. There's a lot of things that can go into why children bedwet. It tends to run in families. So there are genetic reasons that we don't fully understand. But it definitely can have to do with how deep they're sleeping. Some children sleep so deeply that the feeling of fullness in their bladder just doesn't wake them up. Some children have smaller bladder capacity, so it's easier for their bladder to fill up and then they need to go. Some children have very active bladders that just before they even have a chance to wake up, they've already wet the bed. So there's a lot of different reasons that children can wet the bed at night. One of the first things is to talk to your child's pediatrician about the fact that they're bedwetting. Every once in a while there can be medical conditions that can lead to bedwetting, so your doctor would like to talk to you about other symptoms that your child may have and do a physical exam. They may actually do some urinary evaluations as well, just to make sure there's nothing else going on. But for the vast majority of kids, bedwetting is bedwetting. It's a developmental issue. A couple things that parents can be aware of. One is to make sure that their child is not constipated, because if they're constipated, all the stool can actually push forward onto the bladder and cause your bladder not to be able to hold as much. So making sure that your child is using the bathroom regularly during the day and stooling can be a big help. Another thing they can do is to try to limit the fluids that the child is taking in during the evening. So really try to focus on hydrating your child in the morning and the afternoon, and maybe after 5 p.m., really limiting them to maybe 8 ounces of fluid or less.